I'm Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Did you know that frequent ear infections in children can cause a speech or language delay? Ear infections cause fluid to build up in the ear. This can lead to some degree of hearing loss. Once the fluid goes away, hearing typically returns. However, chronic ear infections can cause hearing loss for extended periods of time. In these cases, children can't clearly hear the words being said to them. This can lead to delays with speech and language development. A 2024 study done by researchers at the University of Florida reveals just how strongly this hearing loss can relate to developmental delays. The study showed that kids with a history of chronic ear infections before age 3 had smaller vocabularies, difficulty matching words that sound similar, and difficulty picking up on changes in sounds. If your child has had frequent ear infections and you notice any difficulty with their communication development, ask your doctor for a referral to an audiologist or an ENT, which is an ear, nose, and throat doctor. They can perform a hearing test to determine if your child is hearing normally or if there's any fluid in the ear. If fluid is found in the ear, surgical placement of PE tubes may be considered. An ENT would place the tubes to help the ear drain the excess fluid, preventing fluid buildup, infection, and temporary hearing loss. Your doctor may also refer you to a speech therapist for an evaluation. If your child has a delay in reaching speech and language milestones, no matter the cause, speech therapy may be recommended. Keep in mind that it's common for speech therapists to recommend a hearing test at the start of therapy if your child hasn't had one. It's important to identify any hearing loss as soon as possible. Imagine doing speech therapy for months only to find out that your child is hearing only some parts of what's said to them. If a professional recommends a hearing evaluation, it's best to have it done. The sooner you can get answers, the faster your child can start making progress in their speech and language development.